All right, we want to welcome you into Coronavirus Inside the Arizona Numbers. As we've gone through this summer and talked to you each afternoon here on Facebook Live and on YouTube, it's been interesting, Garrett, to see what is the most anticipated day of the week. For a while, a lot of numbers came out on Tuesdays. We always, of course, look forward to Fridays just for personal reasons and the weekend ahead. But now it seems everybody's looking to Thursdays here in Arizona. And that's because, for those of you watching from other places, a closer look at the metrics, if you will, evaluated week by week, comes out on Thursday. So we just heard from Governor Ducey just moments ago, and we've just gotten a hold of the most recent dashboard, the most recent numbers as they come out in a snapshot look for when certain businesses can reopen and when schools can reopen, although they're at the discretion of their districts to make that decision. These are merely benchmarks. Still, we will go through all the numbers with you here today. And remember, in the comments, let us know where you're watching from. These are mostly Arizona-based numbers that we talk about, but you can apply these numbers to your city or your state to get the very latest information for where you live. Of course, we're not here to make decisions for you. We're simply here to guide you through the data. Let us help you do that by posting comments there in the chat, and we'll help you find that information. I'm Katie Raml. Alongside me here, Garrett Archer, our data guru. Garrett, where do you want to start today? The summary page, or it just seems everybody's so ready to get to these other benchmarks. So we want to let people know in whatever order we're starting, we'll get to each.
We'll just start with the summary page because I'm lazy and I have it already pulled up.
We're good with that.
And then we'll go right to the benchmarks. So here we go today, over 190,000 cases in total today, almost 4,400 deaths so far, 4,383. You can see the new cases a little higher than what we've seen in the last couple days. 1,551 was reported today by AZDHS and 36 deaths. The test numbers, much higher test number than we've had also for a couple days now, about 14,000 tests and 5,000 antibody tests. So that's significantly higher than sort of the test numbers we've been seeing for the last about 4 or 5 days. We did have a drop % positive to 13.9 for the cum, and the serology positive is still at 5.7. So that's sort of where we stand. The more tests today, a slightly larger number of cases, but all in all, it's still a downward trajectory.
And let's go to our most populous county of Maricopa County, where Phoenix lies, and see how things sort of look there as well as we track these numbers. And as you pull this up, I always take time to mention, we talk about the data, we talk about the numbers, but we never forget to realize that there are real people, real lives behind this, and friends and family and sisters and brothers who've been lost or who are in the fight of their lives who are sick. So as we do that, I just wanted to pause to recognize those folks as well.
You see, yes, Maricopa County does have 580 cases that were added today. 24, so a majority of the deaths were added from Maricopa County, about 2/3 it appears. And then we have 5,300 tests reported, still a 15.1% positive. So that number did not go down. However, the serology positive at 6.1 is going up a little bit. So we're starting to see more antibody tests coming from Maricopa County.
And as we talk about those antibody tests, we've gotten a couple questions over the last few days that we haven't had time for. And I want to let everybody know, if you were interested in a free antibody test, they are doing that when you donate blood, either through Vitalant or the Red Cross. It does take a little bit of time to get that information back. Let us know in the chats if any of you have gone to donate blood and gotten your antibody results, and specifically how long that took. It's interesting to track that. It's something that we don't talk as much about. I know not everybody can give blood, but it's just a free option that we wanted to mention if you're interested in knowing what your antibody results are. And always remember, the antibody is a look back at your history to see if you've had those antibodies in your system, if you had been fighting coronavirus in the past, or maybe had such a light version that you never even knew you had, or maybe you were sick over the course of this and you weren't able to go get an actual diagnostic test because we were short on tests at that time, or the wait time was so long that it was discouraging. Whatever your reason, that's a way to get more information on that. So we wanted to pass those two ways along to you if you're interested in it. Don writes, mine was negative. I was hoping to be able to donate blood. So I think Don might be talking about donating the plasma as well. So if you have had coronavirus and recovered from it, there's options to donate plasma to help others who are in their lives right now. All right, so much to talk about today, Garrett. Let's get to the hospitalizations too. It was a little bit different than we've seen in days past, unfortunately, because we had been tracking a downward trend, which we're still seeing, but we did have a pop in a couple of those categories that we need to at least make note of.
Yes, so I've got it pulled up right now. So we'll start. We're just going to go over the COVID-19 specific metrics. So you can see for the inpatient, this is the acute care beds. The downward trajectory has extremely consistent since our July 15th or July 13th high. It has been basically one slope the entire time. We're down to 1411. And we haven't seen this really change much. There was sort of right here in August, there was this slight increase, but otherwise the drop has been about consistent. On ventilators, we had a slight increase today, but realistically, this is pretty much a stay in the numbers, 328 to 334. ICU beds, we did have a decrease in that number. But that, as you can see, our ICU bed numbers seem to be, the curve sort of seems to be changing. That just could be that the remaining COVID-19 patients that are in ICU, because of the situation with their specific infection, they're taking longer to stay in ICU, and there has been no outcome of that case yet. And then the discharge. We can see discharge numbers. We're getting a little more discharge as far as the number of discharges. It's sort of, this whole week has been a little more flat than it has been since the last 4 weeks. And then emergency room, we did get a jump in emergency room today. You can see we were under 1,000 since August 9th, and we went just above 1,000 today. This is something that we just have to watch. It's not, I wouldn't say it's the canary in the coal mine at this point, but the emergency room numbers are probably the most leading indicator we have of what's going on in the community. So to see a little spike like this, we want to see what happens tomorrow. It could be a data artifact. Tomorrow it could technically go back down to low 900s. We just have to watch this essentially. And then the intubations, we saw a large drop in intubations as well. Again, leading me to believe that those ICU numbers are patients that are staying in ICU for longer periods of time rather than new ICU patients.
So we'll continue tracking that information specifically. Garrett, I have an interesting question from Sherry. Do we know where Ducey got his 6% from? And we'll dive into all of this about schools now in just a minute, but let's tackle this question first. Where did he get that specific 6% positivity rate? In today's news conference is what she's referencing, which just happened a few minutes ago. Yes,
so we've got this laboratory testing dashboard right here. This is where you're going to find the percentages that Ducey and that the governor and Dr. Chris are going to be using for opening up. And you can see right here, this curve, these little red dots will give you the weekly percent positivity. And what he's talking about right here is the week of August 9th. We have a 6% positivity at this point. Now, something to always be aware of with this week, there is a reason that Dr. Chris and the government do not use this week to make determinations as to what's going to happen with schools opening up and gyms and all of those sort of benchmarks. It's because, as you can see, there's a lot less tests right now in this week than there are in previous weeks, simply because the week isn't over. There's only 14,000 tests that have been done since August 9th. And the week before that, it was 52,000 tests. So we have a lot of tests to go. It's 6% right now. Usually when it gets to about that number, that 14, 15, 20,000 tests, this percentage point is probably not going to move that much. It may go to 7 points. It may go to 5. We don't know where it's going to land on for at least another 7 to 10 days. But it's probably not going to go back up to like 14% or anything like that.
Garrett, what does the week before say, just for a frame of reference?
8%.
Okay, 8%. So likely it wouldn't go above that 8% if it continues that downward trajectory.
No, we would detect it a little earlier in the daily numbers before we start seeing some higher than some increase that would actually cause this 6% weekly aggregate to go up. Right now, we haven't detected that. The daily numbers, which is if you push this little button right here, it's a little hard to see. I do apologize. See if I can make it a little closer. But it's still kind of hard to, you can kind of see these little red dots. I'm not going to put my cursor there, but these little red dots are the dailies. And you can see ever since sort of that July weekend where the gray bars are very at the top, you can see them going down and down and down and down and down. That 20% at the very, very top, that I know people look at that and say, oh, that's concerning. It's only 5 tests. So that doesn't mean anything right now. In the next 2 days, that 20% is going to go to 6 to 7% or wherever it's going to end up.
Yeah. Debbie's asking, Garrett, remind us how this week runs. What day today is it? Sunday to Saturday?
It is Sunday to Saturday, Debbie. That is the weeks they use.
And what he's got highlighted there are the specific days that you can look a little closer at this. But let's see. So let's talk about schools. A school chart just came out that I think is one of the easiest to read, so that you can see it's county by county is how they separate this. Of course, the big caveat to all this, the school districts can or allowed to make their own decisions on it, and we're seeing that across the state in when they choose to reopen and how they choose to reopen. And if you're interested in tracking that, you can find the very latest lists on the days that they're starting at abc15.com/schools. Our education reporter, Daniel Lerner, has been putting all of that together for you, so you can find out the very latest information and how they changed their dates or how they're thinking, how safe things are for their reopening. So, Garrett, when we look at that chart, obviously it's Thursday. We just got a good look at these numbers. They just sort of reassessed things. A lot or a little has changed depending on what county you're in.
Yes, so this is where we stand right now with all of the different counties and the benchmarks to open up the schools. As you can see, none of the counties right now actually make the requirements to open up a school at this point. They are all missing the percent positivity. None of them from that week. Remember, they're calculating from July 26th. So the week of July 26th, which ended on, as soon as I look at that up, it ended on the August 1st. So everything before August 1st, nothing has had a positivity under 7% at this point. Cases, the definition of this is case rates, a weekly case rate of under 100,000 per population. You can see that there are several counties that have achieved that. In fact, the majority have achieved that. Gila, Graham, Greenlee, and Pima are the only ones so far that haven't achieved that, but they're all well on their way of doing that. And the CLI, which is the COVID-like illness algorithm that's used by the CDC, that one, all counties at this point, everywhere in Arizona, in fact, is well under the percentages, the 10%, excuse me, the 10% that was set for the benchmark. Everyone is well under that at this point.
So that middle column is what everybody's trying to attain at this point. Will anybody be close to that next week?
We can actually go and determine that using the dashboard. So let's go back to the AZDHS dashboard. 1 second. Here it is.
And I'll mention that easy to read graph. I just think that last chart is so easy to read. I've put it on my Instagram account and on my Facebook, and it'll post to my Twitter in just a moment. It's an auto post, so we got to give it some time. But there's my Facebook address if you want a closer look at that chart that just came out. So my Facebook account is facebook.com/news from Katie. If you want to share it or send it to anybody who has school-aged kids, you can find that there.
Okay, so this is the state of Arizona. So this is 10% for the week of July 26th. That's what is on the board right now. August 2nd, the next week to go on the board next Thursday, it's at 8% right now for the state. So let's just go through some of these counties. I'm going to go first to some of the counties that I know just by looking at some of their other data they've already in fact made the moderate status for the business opening. Yavapai County, you can see Yavapai had a 7%, so slightly above where they should have been, and this is what was holding them up right here. They're already at a 6%. July 26th. So when August 2nd becomes the next day, next percent positive that gets calculated out, Yavapai County will have achieved the percent positive. So at this point, it appears that Yavapai County will make the benchmark by this next Thursday when it's calculated. Cochise County, which is the other county that made the business benchmarks, you can see a 7%. That's what's holding them up, right? Or this 9% is what's holding them up. They have a 7%, which is just on the line, and then a 6% on August 2nd. So we have to look really quick. Well, I'm just going to look at them really quick outside of this because I can see they haven't actually they put a decimal you can see that it is a 6.7 on July 26th. So it is under 7% on that July 26th. So right now, Cochise will also make the benchmark by the net. Well, let's see if they make the per capita. I apologize. I have to check to see if they make the per capita. They do make the per capita, so they would both be eligible for a moderate opening on Thursday. Next Thursday.
And then how does Maricopa County look separated out from that?
Maricopa County, of course. So on the school dashboard, Maricopa County right now, it does not have any percent positives within the benchmark. The COVID-like illness is within the benchmark, and the per capita is in the benchmark. So let's see what it looks like in Maricopa. Maricopa right now is not going to even be considered for at least 2 weeks, because there in all of this 6%, while it looks good, we're still not fully sort of formed in that week. That may still go above 7%. But right now, because both of these 2 weeks, 11%, 9% are both above 7%, it's going to be at least 2 weeks till Maricopa could be reconsidered.
So when folks are looking at that, this is, though, a chart that you could check each day to sort of foreshadow how things are going to look. It is adjusted in real time, unlike that chart that's only adjusted every Thursday.
Yeah, by the end of this week, this August 9th will be filled in a little closer to this August 2nd for Maricopa. And so at that point, we'll be able to see this 6% still within that. If it's still under 7% at that point, if it's still under 7%, then that will be 1 week that Maricopa now has sort of in the bank, and they have to achieve another week under 7%.
Wow, so it's gonna be a while for Maricopa County. I don't know. You didn't click on Pinal County yet, did you? And I asked for that because that's where we're seeing some of the schools that are really antsy to reopen. And are they within that metric? I know everybody's met the metric for COVID-like illness, but let's look at that percent positive and see either how close they are or how far they have yet to go. 11%. Okay, 10%.
Yeah, they're 11% and 9% respectively. They're also not within consideration at this point. Right now, they are at a 5%, but only 37 tests for August 9th, the week of August 9th. So that's still up in the air with only 37 tests. We don't know where that's going to land. Excuse me, 712 tests. My apologies. That was only 37 positive. So I would say at 712 tests, they're getting close to having that number, that 5% settled. This first week, this August 9th, may be the first week that Pinal is basically given consideration for, at least it has that 1 week in the bank, this August 9th week.
Yeah, so they would be.
It won't be reflected on the dashboard for at least 2 weeks.
For 2 weeks, yeah. So that's a 2-week wait for both Maricopa County and Pinal County. We'll continue looking at that for folks so that you all who are following us here can kind of get an early peek at how this is going to look. A lot of people are just waiting on those Thursday numbers, but that's one of the luxuries of having Garrett here, is that we can kind of dive into these numbers each day and track how this looks. Martha writes, yeah, teachers at Queen Creek were not given an option for online learning. They were told either in person or resign. Yeah, we're hearing from a lot of pretty upset educators at the current situation out there. All right. Let's see. I want to get to some of the other questions that are coming in, and we'll do that in just 1 second. But a lot of people are asking about opening gyms. That is based loosely on sort of the same metrics as schools, but with a few more step downs at both 10% and 5% and 3%. Do you have that chart available, Garrett, that's just for the gyms close by?
I do. I have to pull up let me get the gyms here. Yes, I do.
A question we're getting a lot, so we'll be able to.
I do have it. I was thankfully able to find it pretty quick. So I'm going to bring up the gyms chart right now.
And as you do that, I'll tell everybody, you can find this list on the Arizona Department of Health's website. They have it for restaurants, for the water parks, for each of these, for schools, for the gyms, movie theaters, all of it. You obviously are agreeing to some hygiene standards. You're saying we're going to seat people far apart at a movie theater unless you're just with your family in your little pod there, that everybody will be wearing masks, that will take temperatures of our staff before they show up to work. So that's all X'd out in the chart because they're saying, we understand that as a business, you're going to sign this and attest to this, that you're going to be working to attain these measures every single day for the safety of your patients or clients or who's ever coming into your business. But specifically with the metrics that need to be met throughout the state, here's where we have this red light, green light, yellow light situation again for opening gyms.
Yeah, so these standards are the same across everything right here as far as what they have to make the green, yellow, red. So it's for percent positivity, under 5% for minimal, 5 to 10% for moderate, and over 10% positivity for substantial. Same thing with CLI, and then you can see under 10 for per capita, 10, 100, and then 100 substantial. So now we'll go into the actual gym metrics. This is what the gym needs in order to go to the yellow. So in the red, they are closed. In the yellow, if a county achieves yellow, then the gym can apply, do that attestation that they are following all of these protocols, and they get an automatic approval, is my understanding, to open at 25% capacity at that point. As far as minimal, so once the county achieves that minimal standard, the green, they can go 50% until under 3% positivity is achieved. At that point, that appears when they would be able to go to 100%. But just basically knowing how this works, under 3% is going to take quite some time to attain.
And Garrett, I didn't see if there was a specific graph, sort of like we saw for the schools, that came out for this.
Yes, I will bring that up right now. I had to give the what it is for them, because the graph for the businesses is exactly the same. It's just that you have to look at what the gyms have to adhere to based on those standards. So now we're going to look at the gym graph. Make sure I have the right one. Yes, this is the workplace graph. Similar sort of feel, school graph, but it does have that extra step. So I've got it shared up. You can see in this particular graph, there is this yellow line, green line that shows the different sort of substantial, moderate, and minimal. And you can see the charts are sort of trying to get down to the green area. I'll take you to as I said, Yavapai has already achieved moderate. So technically, gyms in Yavapai can now apply for a 25% reopening. And you can see right here, Yavapai, both their July 26th, July 19th percent positivity are well in the under 10%. Their CLI is already on the low end of the 10%, almost into the minimal spread. And here, they do have some work to do on their per capita. That's still a pretty significant number of cases that they're adding. So they're not really anywhere near 10 point.
So Garrett, can you click on that same chart? I know, wasn't that Yavapai County? Can you click on that for Maricopa County, since the majority of folks who are joining us in this particular update, we're still in that substantial category, number 2.
Yes, we are. You can see that as far as the county is concerned for the 100 per 100K, we are a little closer in that respect than Yavapai is. We have 1 week that is nearly, if trajectories, if case numbers continue, which we already know that they have continued, so will likely Maricopa next Thursday be calculated into the moderate, at least for 1 week, and then it'll take another 2 weeks if things keep going the same way they are for it to get to achieve moderate status here. As you can see, substantial in both categories right here. We do know that these have already sort of gotten down. I think we said this one's 10.9, this 11%. So we're still waiting for these to go down. We've got at least 2 weeks, because obviously we have no yellows here. And then for the COVID-like illness, we're already in the yellow. So basically, this is the same thing. Maricopa has at least 2 weeks before they can be considered for moderate.
So and moderate is at 50% opening.
25%. So gyms would be able to open at 25% when it goes to moderate.
So it's might not be for many folks a big celebration for those places to be open, because there are several gyms that if it's limited to 25%, if you're going at busy hours after work or things like that, I mean, if you can't get on a machine anyway, or you can't get to the area you want to use anyway, and the gym's already saying we're going to limit it down to 25%, then for a lot of folks, their monthly fee, it doesn't even make it worth it. They would still keep their gym membership on hold or pay a hold fee or whatever it is, because if they're paying top dollar for their gym or even for a moderately priced gym, they're paying for the full gym. And so it'll be interesting to see if they'll adjust prices or how they'll do this to accommodate their clients. It'll be interesting to see. I know some people were posting on here that there were going to be sign-up sheets for 1 hour that you'd have to make like a reservation for your gym. And that's what some of the smaller boutique gyms do, say like a Pilates studio or something where they have a set number of machines, like 12 machines for a class. So you couldn't have more than that many people. But even limiting that down to just 6, you wonder if those places can even be viable and for how long that they can make enough money to be able to stay open like that. So
yeah, if you look at this trajectory, even if these trajectories continue on both of these in Maricopa County, that 5% number, as you can see, we're at least 5 to 6 weeks off of that green if things continue in the exact same trajectory. So this is what it kind of appears it's going to be: 3 to 4 weeks in the moderate period for gyms. And then if things are going really well and we continue on this downward trajectory, then, in about 5 to 6 weeks, they might be able to go to 50%.
Yeah. Let's see. Tammy just wrote, EOS is not charging our memberships. Their memberships are frozen, which also means that they have no income. Tammy's exactly right. It's this conundrum that so many different places are caught up in. Sarah writes, I feel for the small locally owned gyms that were doing all the things to keep their customers safe. Yeah, exactly. There are so many businesses caught in the middle of all this, whether it's restaurants or gyms like this, or the water parks who are saying we're not going to open all summer, and that's their livelihood for the whole year. So there's a lot going on for a lot of businesses and a lot of people. Then never was there a promise that a pandemic is easy. That is for sure. We've all been hit in many different ways. All right, let's see. As we talked about the gyms and the schools, can we also talk about kids? Because we've gotten many questions about how many kids have tested positive. And I want to let everybody know there's a whole demographics page over on the Arizona Department of Health site that will let you know a little bit more about age groups. So this age group in particular is split from 20 and under. We wish we had more specified information on the ages of these kids to help you better understand so you can make the best choices for your kids and grandkids and your family. But they divide this particular chart into 20 years and under. So it's the best we have to go by, but we're happy to share it with you so that you can get the latest data on it. And Garrett, the last time we checked here for the state of Arizona, there had been about 20,000 kids who have COVID.
Yes, I'm pulling it up right now. I was just getting the percent positive calculation for the under 20, just so that we have that. It is 23,000 kids. That's about 12% of all cases. When we look at the day-to-day growth, it's sort of on par with all the demographics right now. It is. I did see that story about how Arizona does have more kids per capita with COVID-19, or at least under 20, than I think it's every other state. However, if that is the case, we still that demographic has the lowest impact of COVID-19 right now. There's less of that demographic per capita than any other age demographic that has been impacted, even with those numbers that were reported in the story. So, and that's like I said, 23,000, 12%. I looked at the test numbers. It's about 17%. So that's the percent positive of all cases, both serology and PCR. If someone under 20 took a test, there was about a 17%, so 1 in 5 basically that they tested positive.
Oh, Kristen's asking a really good question. Kristen writes, when will the Maricopa County page be out with all the school info? She remembers us talking about that. Kristen, yeah, we got that information from one of the news conferences that they had at the county. Let's see, it was probably a week and a half ago now. I'm thinking all the days run together when you're teaching your kids at home and working from home and all the things. But it seems like I don't want to say should have, because I know it is a ton of work behind the scenes to sort of put this together. But they were promising it broken out by both zip code and by county, by school district. So several different ways to look at that. Garrett, I know you have friends who work over there. Have you heard anything more about how soon this information will be out for folks? And then in the meantime, we can show them where the zip code map is for the best backup information until we get that coveted dashboard as promised?
I haven't heard anything as far as when the dashboard is going to be ready. I would presume that we will have another Maricopa County Health press conference with Dr. Sunshine that will be sort of the unveiling. I could imagine that they're very quick over there. So, you know, a week and a half, that sounds like a long time, but for developing such a robust application, that's no time at all. I mean, most of the time, if they were going to do something like this, it would take 6 months to do, and they're probably trying to put it in much less time. So I do have the dashboard or the zip codes from the EasyDHS pulled up as a proxy. You can see that it's right here in the zip code button, and you can come down here and see what the zip code map looks like. It does sort of stop at 1,000 and just kind of puts everything in after 1,000. You can see a lot of gray. This is the tribal zip codes. The tribes have decided that they will not give the zip codes to the health department or give permission for them to use the codes, which makes total sense. I used to be in registration, and the zip codes are meaningless up there anyway, so it wouldn't be any it wouldn't be of any use. So this data is just for places that are much better for zip codes. And you can see here's Maricopa County. The most impacted area of Maricopa County is the southwest region. It has many more cases per capita than any of the other zip codes or regions of Maricopa. You can see there is some in Scottsdale, not much in North Scottsdale, not really that hard in the East Valley right here. This sort of is the concentrated area right here.
So you can find that right there on the Arizona Department of Health site as well. We had told folks for a long time it clicked through to a separate site that sometimes looked a little shady, but now it's right there embedded in that page, and you're able to check it out. Thanks for pulling up Yuma. We've had a couple questions about whether Yuma is a hot spot right now. And of course, all eyes on Yuma on Tuesday as President Trump is set to visit that area. How do things look right now?
So Yuma County was several weeks ago in July. Yuma County was the hotspot, only in Arizona, but in the country. Yuma and Imperial Valley were growing at levels that really hadn't even been seen when New York was having its increases. Now, as far as our zip codes, because of those increases, they do have the two top zip codes with the most amount of COVID cases: 85364 with 4371 and Somerton 85350 with 3711, two very zip codes for case numbers. However, their growth in the past 2 or 3 weeks has slowed considerably, and I wouldn't really consider them a hotspot any longer for growth at this point.
Garrett, thank you. Sultan writes something really interesting. Just a quick topic. Sultan is replying to someone else, but it's a really valid point that we see brought up a lot. Sultan writes, what part of global pandemic do you not understand? This has nothing to do with U.S. politics. This is an international public health crisis. So true. So many people think about the U.S. and forget all the other places around the world. We have 188 countries dealing with this. Although a pandemic, of course, affects an election, and Garrett, you can attest to all of this. What's going on in a community does affect an election, but it's not the reverse. The election is not going to then wrap up the pandemic. We wish the pandemic would go away at any point. At this, the earlier the better, but we don't get to put those requests out there. This is 188 countries, more than 20 million cases of this worldwide. This is not a US-centric problem, even though we have the biggest numbers of this per capita right now.
I mean, there's always going to be, obviously it already has happened, where there's going to be areas in which the response to COVID-19 is going to be interjected and intertwined through the political process. You know, you're going to have, people on the left or organizations on the left are going to criticize Donald Trump, Doug Ducey, any Republican leaders for their response to COVID-19. And you'll see on the right, you'll have sort of the opposite happening. Well, you'll see sort of groups and organizations putting out ads that are praising, Donald Trump and Republicans for the responses. So it will intertwine there. But as far as the data is concerned, I would say, yeah, it's kind of sad to see how the data has been politicized. It's realistically, you're talking about a bunch of bureaucrats that are inputting this data, and what people are presuming is political, at least on the data side, is simply just not really there. It's just that because these health statistics are not something that anyone is used to seeing in real time. Health statistics are normally compiled over a year, and then they show up in white papers, and they show up in press releases, and they show up in news stories, every once in a while. But they're compiled over a series of time. They're refined, looked at a bunch of times from a bunch of different levels, and now we're getting them in real time. And because of that, it adds to some confusion. People don't really know what's going on with the back end of this because of HIPAA concerns. So we don't get to see the back end of the data. So it causes sort of this lack of transparency that then causes people to mistrust the data. And just I said, I worked in government for several years, and I can just tell you that based on the people that I know, of course, anecdotally, that these people are not going to do something because an administration in Washington, D.C. tells them to do something. In fact, I would surmise that most of these epidemiologists that are putting in the AZDHS data are all, highly educated, top graduate people. They likely didn't vote for Donald Trump, so we would have had a whistleblower on our hands or something if something was actually going on where someone was telling them to say, hey, you need to present the data this way because it's going to make our boss look better. We would have had, hey, this is not right. So that's sort of my, experience in government as to why I think, and I just don't see a situation in which the data is being manipulated.
I just, Garrett, I wonder if in other countries that have an upcoming election, they're writing on social media, oh, this will all be over when the prime minister, this will all be over when so-and-so votes for so-and-so. It's an interesting argument when you have something that is global. This is not just in the United States.
Yeah, correct. I mean, it's not. And again, the CDC doesn't care who is losing an election. So they're not going to, the data that they have is going to be this. And even if you say, oh, well, the CDC doesn't have the data and the HHS is has it, okay, that's fine. But then you've got 50 other states that all have different data. And most of those states are not most of them, but a portion of those states are not friendly to Donald Trump. They didn't vote for him. So why would they put out things that were good? Or, it's just there's too many moving parts for it to be this conspiracy that's just sort of under one umbrella.
Yeah, it's even more time than I wish to spend on the topic because it's so far-fetched to say that, oh, it'll just be gone after the election. Bottom line, we want it gone now. If we could have it gone now, my gosh, if we could have it gone months ago, what we wouldn't do.
I would love to go back to covering elections. Thank you.
Yeah, exactly. And all the other things. Let's see. Oh, somebody just wrote a thank you, a couple thank yous. So you're very welcome. Thanks for taking time and joining us on here. And Tehran writes thank you as well. My daughter has a friend in her class named Lauren, so I almost called you that. Let's see. So many more things to get to that I want to make sure we touch on everything. Was there any number that you saw, Garrett, today in these last few minutes as we're starting to run out of time that was really of particular note to you that you wanted to continue to track, or you'll definitely be watching over this weekend?
We'll go to the, we didn't do the R-naught, no, we've sort of made to talk about the R-naught. So we'll just go to the R-naught really quick, just to give people an update on that. So I've got it pulled up. I'll darken the screen so it's a little easier to see. And here we go. Arizona's doesn't have the best anymore. It's still under 1, the 0.83 with a 0.61 to a 0.97 range. Maine has a 0.62 to a 0.93 range at an 80 estimate. So it's a little better. And you can see the error bars are also a little smaller than Arizona's, which means that the estimators are saying, well, we're a little more confident in Maine's numbers than we are in Arizona's. But we still think I think we decided an 80% confidence that Arizona is under 1 at this point, as well as all these other green, all these other states, like Colorado, are now in the under 1 category.
Yeah. Nick was asking a question about his bowling league and staying safe. Do you think coronavirus should be a concern, like on the balls, on the rack? The one thing I can tell you, Nick, is that we're not doctors, so we're not here to, tell you how to bowl safely, but we can say that the masking appears to very much be working. So obviously wearing a mask while you're out there bowling and sanitizing everything when you're, sharing bowling balls or racks or anything out there to be safe. So we're not here to make decisions for your life. We're just here to help supply the data to you so that you can make the best decision that works for you. But I do think those things can be done safely, by taking the same safety measures that we've shown.
Yeah, absolutely. I wanted to go over Sarah Serg before we finish here. I know we're getting to the end here. She was talking about the cases being super old, and she is not incorrect in that. Today, we did have a drop from a laboratory that had a tremendous lag in it. We haven't had lag for weeks, and one lab dropped today, and our lag was 16 to 18 days. So there were people today that were put in the system. So people yesterday, essentially, that took a test 18 days ago and got the results from AZD or from the lab. And you said, I think you said we sort of already know which testing facility that was.
Yeah, in fact, they had reached out to us at ABC 15, and we had been in communication with them about why this was taking so long. And on the flip side of that, Sarah and Garrett, I mean, if we're frustrated by the delay in data, imagine how those people feel. That means they're just getting their information on their test as well. So there were cases of people who were still waiting 2 weeks. So hopefully now that information is coming out a lot faster for everybody. You had some tracking, Garrett, of the lag time, and it was down like less than 4 or 5 days, right?
Yes. So yesterday when we tracked I've been tracking the lag dynamically every single day. I've got it pulled up. It's not the 4-day, it's the 16-day lag because it's today's curve. But we've been tracking this, and for the last, ever since SonoraQuest finished up their backlog, we've been tracking it 4 days lag. As you can see, today's number, light blue, is what was today. I have the lag calculation right here. It might be hard to see, but it is 18 days. So tests were added to the system from 18 past today. We haven't seen several, like I said, about almost a week and a half, 2 weeks, where it's been 4 days, 4 days. People were getting their test back within 36 hours. And today, and we know it's not SonoraQuest. It was a lab outside of Arizona that dropped tests today. And that's what's causing this lag. But likely, unless this certain laboratory is going to continue sending tests, I don't know how many tests they have in their backlog. We'll go back to 4 as soon as that particular laboratory is done.
Yeah, they were saying that was at the Emory site, and hopefully they've gotten that all cleared up. Sarah writes, well, first of all, Nick writes back, thank you, Nick. We're happy to help. Thanks for the question, and I'm glad we got to at least one of yours. There's been a lot of thoughtful comments on there, so I want you to know we're trying to read all the comments, even though we don't get to answer all of them. Sarah also wrote back, following up, my daughter and I got tested last Saturday, had the results in 24 and 48 hours. First took a little bit longer. That's kind of the normal turnaround that we're seeing now is about that quick. So yeah,
the backlog.
Yeah, and ASUs are pretty much that quick. That's where I went, but got my answer in about 48 hours. Sarah, hopefully you and your daughter aren't feeling sick. Hopefully you're just getting tested because you're curious. I hate to see people not feeling well right now. So Al writes, nice job with the statistical reply from Garrett to Katie's comprehensive and analytical questions. Thank you, Al. Very supportive for both Garrett and I. We appreciate that. Margaret's writing, thank you for the info. Everybody stay safe. Sanitize, love thy neighbor, stop fighting. I'm with you, girl. Love that. That is where we will end today. We want to remind you, we'll have a complete wrap of the governor's comments coming out of his news conference and a look at all of these numbers, a complete wrap on the day coming up at 4, 5, 6, and 10 p.m. You'll want to set your watch, set your timer, whatever it is that you keep track of the time. For 6:30 tonight, we have a series called Full Disclosure. Maybe you've seen some of our stories or reporting over the last few days. It's ABC 15 investigator Dave Biskibing with a full half hour of really incredible storytelling, really important stories about the Brady List here in Arizona and how that pertains to everyone's safety and how that is also being used against our officers as well. So you'll definitely want to catch that reporting at 6:30 and then all of the day's news at 4, 5, 6, and 10. As I mentioned, you can find the latest coronavirus information at abc15.com/coronavirus. Follow Garrett over on Twitter for these awesome snapshots early in the day around 8:30 to 9 in the morning. I get my coffee ready. I sit down. I usually retweet what you've put together, Garrett. It's helpful to see a quick snapshot of both the hospitalizations and then also the data coming out of the state on the summary page, and then that all important % positive that we track so closely. And I'm on Twitter too, at Katie Raml, and you can find me on Facebook, where so many of you have, and you can find that chart on the schools right now posted there at facebook.com/news from Katie. So we'll wrap it up there today. We want to thank all of you for trusting us to guide you through the numbers here in Arizona, and we invite you back tomorrow at the same time.